New here at 9:30, the U.S. experiencing a surge of COVID cases as health officials track several new variants that are gaining steam right now. The latest data from the city of Chicago shows us the daily infection rate rising from June and July to now. You could see it's now above 4%, and that's compared to just 1 to 2% earlier in the summer. Joining us now to dive into this is Dr. Katrine Wallace, an epidemiologist and assistant professor at the University of Illinois. Dr. Wallace, thank you for being with us.
Thanks so much for having me.
So something that a lot of us have noticed, more people around us, maybe ourselves, our family members, are getting COVID again. Why are we seeing this uptick in cases right now?
Yeah, you might notice that around you, there's, anecdotally, a lot of people getting COVID right now. And the reason for that is we had one variant that was dominant for most of the spring and summer, and that was called XBB.1.5. So we had sort of a nice little honeymoon period where people might have gotten COVID in the spring and then had a nice dose of immunity while that variant was dominant. Well, now we're starting to see sort of a potpourri of variants now, a handful that are coming in, and it's especially EG.5 is the variant that we're sort of keeping an eye on here in the Midwest.
And why that one specifically?
Yeah, so that one had some mutations that cause it to spread a little bit easier. You might have heard it in the media referred to as ARIS.
Okay.
And it just has some mutations that cause it to have an advantage. That's what viruses do. We're going to continue to see this because that's the way viruses survive. They develop mutations so they're able to spread easier. And so that's how COVID keeps becoming new variants and spreading more. Every time we get a new variant, we hear that it's more transmissible than the last because of these mutations that it's able to develop. And so now the people that had immunity before maybe don't have it anymore because now we have all these new variants popping up that are more transmissible.
And we know because of that, we're seeing more people in the hospital, and the CDC right now forecasting that we're going to see an increase in admissions over the next few weeks, possibly through September 18th. What are your thoughts on that prediction from the CDC, and is this cause for concern for us locally here?
Yeah, so we have seen an uptick in hospitalizations. Nationally, we're seeing about 15,000 hospitalizations a week. In Chicago, we are seeing an increase, but it hasn't been as large as some other parts of the country. That doesn't mean that we're not going to see that. It just means that so far we've been in a pretty good shape. But to put it into perspective, even the national numbers sounds like a lot of people. But if you compare that to the peak of the Omicron surge when we had like 150,000 hospitalizations a week, we still are about 10% of what we saw at the peak of our Omicron surge in January of 2022.
And that is good perspective, but I would say it's difficult when you start seeing more and more people and hearing about more and more people. You kind of go, oh no, not again. And we know there's another vaccine coming out in the fall. What do we know about this latest shot?
Yeah, so we are having a new vaccine that's coming out in a couple of weeks, so that's great news. And the thing that's really good about it is it's going to be targeted to the XBB variants, which are circulating now. So this vaccine will bring people's protection up to date. So you might think, oh, I've already had the booster, but this booster is new. It's a new formulation. It's going to be very much like your annual flu shot, where you update your protection to the current virus that is circulating now in the community. So it's really important for people, especially those people that are high risk, like elderly folks or people with a comorbid illness, to get these shots.
And I know that vaccine's not out just yet. So what should people be doing just in the meantime to protect themselves and their families? And of course, a big question so many people always have is maybe could we see masks making a bigger comeback, or should they?
Yeah, so that's a great question. So you're right. It is going to be a couple weeks till we see the vaccine rolling out, and we are seeing an uptick in cases, and we definitely have data to support that in the wastewater and, like you said, the hospitalization rates. So we can, in the meantime, use masks. Masks are a great option. The way I like to think about protective measures is that, when it's basically each layer of mitigation is like a layer of Swiss cheese, right? There's holes in it and the virus can get through. So when we have more virus around, we need more layers of Swiss cheese. So people might roll their eyes and say, oh, masks again. But when we have more virus, it's smart to add more layers of mitigation, more Swiss cheese layers, so we have less we're less vulnerable to the virus that's circulating in the community. So masks are great, especially in indoor closed spaces or crowded spaces, or maybe just avoid those kinds of spaces for now. Another great option is testing if you have symptoms. A lot of people assume they have allergies, and a lot of these things, COVID-19, the flu, RSV, allergies, all share symptoms. So it's really good to know if you have COVID by testing before you go someplace. Also, just the basics like hand washing and good ventilation. So all of these things, like I said, the more virus we have in the community, the more layers of mitigation we can use to protect ourselves.
All right, Dr. Katrine Wallace, we really appreciate your time and expertise. Thank you so much.